All right, diving right in today, we're tackling a really big one. And I know you guys are all about getting to the heart of complex issues quickly.
Absolutely.
So no messing around. We're going deep on systemic racism in U.S. healthcare. We've got a whole stack of research here ready to break down the causes, the impacts, and really importantly, what we can actually do about it.
Yeah, it's about going beyond just individual prejudice. We're talking about how racism is literally built into the structures of our healthcare system.
Exactly. And we're going to look at the real-world effects, those disparities, and what the data says about how to start fixing this deeply rooted problem. So, to kick things off, our sources all point to this idea of systemic racism.
Right, like it's this theory, right, that racial inequality, it's not random, it's actually maintained by these big societal systems, healthcare being a huge one.
Yeah, it's baked right in.
Yeah.
And what's wild is how much history still plays a role.
Yeah.
I mean, think about it. Practices like slavery and segregation, they didn't just disappear,
No, they laid the groundwork for the inequality we still see today.
which is where this idea of structural racism comes in.
Exactly. It's about the specific laws, the policies, even just the unwritten rules that disadvantage minorities, like real tangible things.
And one example that really jumped out from the research was how funding decisions for Medicare and Medicaid, early on, they were influenced by racial bias.
Right. So you're essentially embedding these inequalities in these, foundational programs from the get-go.
Yeah, right from the start.
And that historical context, it helps explain why we keep seeing these health disparities. The data is consistent. Racial and ethnic minorities get lower quality care than white Americans.
And it's pretty stark. Like, we see that Black patients are less likely to receive treatments that are proven to work for heart disease and cancer.
Right.
And maybe the most alarming stat, Black women are twice as likely to die from pregnancy-related complications compared to white women.
Yeah. And that's regardless of education or even access to supposedly good health care.
It's really troubling. So the question becomes, what's at the root of these differences? Our sources point to a few things, like unequal access to good health insurance and quality facilities is a big one.
Huge. Expanding Medicaid's helped, but it hasn't fixed everything.
Nope. Not even close.
Yeah.
And it's not just about physical access either. We've got to talk about implicit bias among healthcare providers.
Absolutely. Those unconscious attitudes can impact how treatment decisions are made.
Yeah, leading to, again, different quality of care for different people. And then we've got the socioeconomic factors, right?
Right. You can't ignore how things like redlining, that practice of denying services based on race, it created these lasting disadvantages in minority communities, which directly impacts their health.
Absolutely. So where do we go from here? What do our sources suggest? One thing that came up a lot was cultural competency and humility training for healthcare professionals.
Right. It's about raising awareness of those biases and improving how they interact with diverse patients.
Yeah, that patient-provider relationship is so crucial. And then on a bigger level, we have policy changes.
Definitely. Like expanding Medicaid even further and addressing those social determinants of health, housing, education, all of that.
All those crucial pieces. And we've also seen some legislative action, like declaring racism a public health crisis, which is a good step.
Yeah, it shows that we're starting to recognize the systemic nature of this. Like, this isn't just a bunch of isolated incidents.
Right, it's all connected.
Yeah.
So for everyone listening, what's the takeaway here? It's that to fix these disparities, we need a multi-pronged approach.
Absolutely. Policy changes are essential. Addressing biases within the system is key. And we need to acknowledge how historical racism continues to have an impact.
And that brings us to a final thought. We've been talking about these big societal structures, but think about how they directly affect you, your health, your community. How does understanding this systemic issue change how you view healthcare access and equity in your own life?
Yeah, it's a lot to unpack, but awareness is that first step towards making real change. So much to think about.
Thanks for diving in with us today.
See you next time.
Catch you later.